Welcome back. Problem joints can really slow you down and negatively impact your everyday activities. And Dr. Stanton Longenecker is part of the Jacksonville Orthopedic Institute, where physicians are using innovative treatment options. And Dr. Longenecker, it is so good to see you. Thank you for taking the time to join us today.
It's my pleasure.
So let's talk first a little bit before we get into what you have in front of you and the new advancements and technologies that you have at JOI. Let's talk a little bit about your practice, JOI, in Riverside.
Well, I started life as a sports medicine physician. I studied with Jack Houston in Columbus, Georgia. And I came, as my population got older and older, I started finding new and different things to do. And then I got involved in manufacturing because I have an engineering background. And that led to the development of multiple different joints, some of which I'll show you today.
Right, and it's just amazing some of the advancements that you've been able to come up with. First, let's talk about the patients that you see typically in your office. Who's coming to see you?
Well, I'll see anything from Pop Warner football players all the way up to a 101-year-old fellow that I put a total knee in the other day.
Wow. So it really ranges the gamut. And also, you've been able to create a gender knee, and this is something that you found to be really important because when you were doing knee replacements, you found that the knees are not created equally when it comes to men and women.
Let's be honest here. You're a lot different from me, and so is your knee different from mine. And that was a problem we were seeing. We were trying to fit a knee that was designed basically off a model of men, and then try and fit it into a woman. And oftentimes it would just be too large. If I showed you these models right here, and you zoom in on them, they look pretty much the same when you look at them from the front. But if you turn them, all of a sudden it becomes very obvious. Oh, it just fell apart.
Yeah,
it becomes very obvious that
difference.
This guy over here just might be the guy, and this one over here just might be the girl.
What were you finding then were the adverse side effects for women getting a knee replacement that was designed for a man?
Well, most orthopedists are men, and most women were the ones complaining about knees, so they just assumed it was women. Well, it wasn't. It was a difference in the geometry of the knee, and we finally ran a study that showed that that was exactly what happened. So we created a knee that fits women instead, fits nicely. But if you take that same knee and put it on a man,
you notice that
it doesn't fit very well.
Wow.
Vice versa, if you take a man's knee and put it on a woman,
yeah, you're not going to get nearly the same.
it hangs over the edge and it hurts the ligaments.
I know this is the first time that I know that we're...
How about that?
This is the first time that we're really hearing about this. But is this really something that has spread across the United States? I mean...
This has actually been out for a while, but I'm reintroducing it because I'm seeing again, I'm starting to see patients coming into my office again, women, where the knees aren't fitting, and I'm going back and putting in a knee that fits, and they're out of pain.
And they're out of pain. So that's the huge difference, is just getting a knee replacement that fits your sex. Let's talk about the hip replacement too.
Sure.
You also have a development with that. What is it?
Well, this one just came out, and this one's designed specifically for anterior hip surgery. And although it works perfectly well from the back, it allows the curve to fit and come straight in from the front.
Okay.
When we do these from the front, we're using half the amount of incision, and we have to elevate the femur up out of the way and then slide this implant into it. When we go from the back, everything's wide right there, and you have plenty of room to put in an implant. But when you go from the front, it's a very tight space to come in next to the pelvis. But there's such an advantage to doing it that way. I mean, I had one guy in my office who came in and he'd walking 4 miles a day, 2 weeks post-op, no ambulatory aids, nothing.
4 miles a day, 2 weeks.
And the other advantage for an anterior approach is you can bend over like this all you want right after surgery. If you did that with a posterior approach, it would pop out a joint.
These are all new advancements a lot of people at home who might need these procedures probably haven't heard a lot about. What do you recommend that they do to learn more? Should they come in and schedule a consultation with you? How best do they go about it?
We have a wealth of knowledge on our website that if people just drop by and go to joi.net, you're going to find orthopedists putting articles in there that they can read. Of course, anterior approach is the hot buzz on the internet right now. You just have to go anterior hip and you'll see thousands of articles. And
is this because it's relatively new and it's becoming the best way to then treat this problem?
Well, it's not new. The approach has been around forever. I used it for years early on in my practice, but I was having too many problems with the approach. Now that we've designed implants that allow us to do this, and we've designed tables that position the hip easily, it has become a much easier operation. When I did them 20 years ago, It was a 2.5-hour operation. Now I can do it in about 35 minutes.
It's just amazing. And then to have one of your patients up walking 2 weeks later,
And no pain.
4 miles a day with no pain.
Yeah.
Just goes to show that if you do have pain, that you should come in and there is something that you can do about it.
Well, there's a lot that can be done.
All right. Well, it's good to see you, sir. We appreciate
Pleasure.
you. Thank you for taking the time to join us. And we'd like to thank Jacksonville Orthopedic Institute for sponsoring this segment. You can find out more information and you can find an office nearest you by visiting joi.net. You can also get more information on the procedures by heading to that website. You can call their number 904-JOI-2000 to schedule an appointment as well.